Shoulder fractures are another very common injury in the practice of a shoulder surgeon. So I see routinely shoulder fractures, and the bone that most commonly breaks in the shoulder is the proximal humerus. So that's the arm bone up in here. Shoulder can get fractured from a fall. It can be a high energy injury too, like a car accident or a fall off a ladder or just simply a ground level fall. Treatment for these injuries is based on the severity of the injury. So if a fracture is in good alignment and the bones are not badly displaced, then we will treat these injuries in a sling with immobilization, followed by physical therapy and a gradual return to activities. Now, if the bone is displaced or it is out of alignment, then we will typically fix it with surgery. These days we use locking plates where the screws actually go into the plate and they lock into the plate. So you can see here, this is an actual implant that can be used on a patient. You can see as I push these screws, they're not toggling. That's because the screw, when it goes in, it has threads at the end and it locks into the plate. So this is a very fixed angle, very stable construct. This is what we use today to fix these fractures. So the plate goes into the arm bone and holds the ball against the shaft and allows it to heal. This is what the arm bone looks like, the proximal humerus. So typically it will fracture in this area somewhere, and the plate goes in, the plate sits up against the bone, and the screws would go in and hold various bone fragments in alignment while they heal. You will sometimes use X-ray to see where the screws are going, but a lot of times it's based on preoperative planning. I know before I go into the operating room to fix one of these fractures, where the fracture is, how the bone is displaced, what do I need to do to get it back in alignment, and which direction I need to put in my screws. And sometimes if we're not sure, we'll get an X-ray during the surgery or just confirm with an X-ray at the end. But during fracture surgery, X-rays are used very frequently because we want to make sure that the screws are in good alignment, not just with shoulder fracture repair, but with any fracture repair. For example, these screws, you don't want them to be sticking out through the bone, because if they're sticking out through the bone, then they can damage other things. So they need to be inside the bone. This plate needs to be like flush right up against the bone. If it's malpositioned, it'll irritate the tissues. So that's where experience and also intraoperative X-rays come in to make sure that you have good alignment and the patient's going to get a good outcome. These surgeries are done on an outpatient basis. We immobilize patients in a sling post-surgery for about 4 weeks. We start physical therapy 2 weeks post-surgery, and we gradually return them back to normal function based on the healing of their fracture. So every time they come in, we get serial X-rays, and typically the goal is to have them get back to normal use anywhere from 3 to 6 months post-surgery.